cohort 5, our primary objective was overall survival, because we know this is a poor prognosis situation. Leptomeningeal carcinomatosis is sometimes hard also to quantify per se. HER2 is not working very well for this, and we wanted to know how long these patients would live under trastuzumab deruxtecan, and indeed we find a very impressive overall survival for these poor prognosis patients, because we know that leptomeningeal carcinomatosis is a terminal event in patients with breast cancer tumors, with breast cancer, and we found a median OS of 33.3 months in 7 patients, and with 2 patients that data cutoff still ongoing treatment, which is quite good for this population, with a median PFS of 8.9 months. I think that specifically for leptomeningeal carcinomatosis patients, we clearly have an unmet need, because when patients develop, we never know quite for sure what to do to these patients. We have some small retrospective analysis of the treatment with this drug or the other. For recently this year, some authors have published the results on retrospective analysis of patients with leptomeningeal carcinomatosis and HER2 positive advanced breast cancers treated with trastuzumab deruxtecan, but again, retrospective data. And this is the very first trial showing prospective data on the use of trastuzumab deruxtecan in leptomeningeal carcinomatosis patients. It's a phase 2 trial, of course, we acknowledge that, but we will never have phase 3 trials in this population, at least in the next years, because leptomeningeal carcinomatosis, fortunately, is not that frequent yet, I would say. But I think the major strength in this trial for our clinical practice is that it's a phase 2 trial, prospectively showing good results with trastuzumab deruxtecan in this population.